Under the hot summer sun, on any given corner in Los Angeles are people like Teresa selling masks. If you ask them their story, a lot of them sound like this.
She
said that everywhere that she was cleaning houses, they all told her that she wouldn't be able to come back until the pandemic was over.
But she has kids to feed and a family to provide for that every day begs her not to go out because they're scared she'll get sick. And she says she worries about the coronavirus too, but mostly because of those not wearing masks.
Un 98% de hispanos están usando la mayoría de mascarilla, o sea, ellos están usando más mascarilla.
She says that out of the people that she's seen, she would say 98% of the Latinos that she sees walking around are using masks, and she says the percentage just isn't that high with the white people that she sees.
Que la gente anda violenta ahorita. Veo a la gente de mal humor.
She says that she gets mad when she sees somebody without a mask. She doesn't want to say anything because people are very violent these days.
And for the most part, a lot of Latinos do seem to be taking mask wearing seriously. Even those who say they aren't afraid of the virus, like this man, still have them on.
You're 85 years old.
Yeah.
Are you worried about COVID-19?
No, I'm quite worried about it. I can't go out without a mask. If I go into the where I get my mail inside the senior place, I have to have the mask on. Or she'll tell me, hey, where's the mask on?
So if mask compliance is high, what explains the disturbing fact that Latinos in Los Angeles are twice as likely to get COVID-19 than the white population? We asked Dr. Efrain Talamantes, who focuses on reducing health disparities.
We know right now COVID-19 is affecting Latinos in a disproportionate rate.
Right.
What's going on?
We find ourselves in testing deserts, not enough access to testing, and our communities need it. We need to know if someone's infected so that we know what precautions to take as a community.
And those testing deserts in places like East Los Angeles mean lining up for nearly a mile at nearby Dodger Stadium. There's even less access for those with no cars or grueling work days where one missed shift could mean no more job.
Out of everything you've seen, what concerns you the most?
One of the key things that I am concerned about is when the government's making big decisions about where resources go, it's not coming down to our communities.
And yet those are the people that are on the front line when it comes to being essential workers at grocery stores.
But they're the same people that are delivering our food when we're sheltering at home. They're the same people that when we go to the grocery store are there helping us.
Also in that essential workforce, those in agriculture fields and meat processing plants where outbreaks have been unrelenting, especially for those living in cramped conditions with many others where there's no room for quarantine or isolation. Even in the very places making the masks to protect us from COVID-19, this week LA Apparel shutting down 3 factories after 300 workers tested positive for the virus and 4 died. Some of the over 1,000 Latinos who have lost their lives in Los Angeles to a virus deadly regardless of race, but here still killing twice as many people of color.
Eso es lo único que les puedo decir, que esto no es un juego, que esto es un virus y que te mata.
She says that this isn't a game. She says this is a virus and this virus will kill you.
And Gadi joins me now. Gadi, this is both a health and an economic crisis. What sort of help is there on the financial side of things for low-income workers who are maybe struggling to make rent, pay their bills?
Yeah, Allison, I'm so glad you asked about that. That woman, Teresa, she told us that every day that she works there selling masks, it still doesn't make enough money to pay her rent. It only makes enough to put food on the table and help some family back home in Guatemala and El Salvador, but nowhere close to the $1,800 that family, the multi-generational family, pays rent every single month. So yesterday, we just heard an announcement from the city of Los Angeles. They are setting aside $100 million to try to help people with rent. Each person or each family can qualify to up to about $2,000, $1,000 a month, up to $2,000. They opened up applications yesterday, and they were supposed to go until July 17th. They were hoping to give out that stipend to about $50,000, although yesterday we also got word that shortly after they opened that up, 150,000 applications came in, so clearly not enough money to go around. Allison?
Gadi, we also know access to testing, high-risk jobs. These problems are not unique to the Hispanic community in L.A. How is this virus affecting Latino communities in other states, other parts of the country?
Yeah, it's not just here in L.A. I mean, L.A. is interesting because we have a 49% population of Latinos here, which is the largest demographic as it is. But across the country, even places where Latinos make up 15%, 20% of the population, Chicago, Virginia, places in Texas, you're still seeing them over-index when it comes to COVID-19 contagion. And one of the other things that we're seeing that's extremely alarming is it's not just people are more likely to get COVID-19 within the Hispanic community. They are also much more likely to die. The mortality rates are higher as well in many of those communities. And another thing that is particularly alarming that some doctors are now seeing is that mortality rate also means that younger Latinos are dying at a disproportionate rate. So alarming all across the board, more likely to get COVID-19 as well as more likely to die. And many of those people that are dying are young Latinos.
For me, the greatest challenge of teaching online this fall is going to be recreating the sense of connection that students feel in an in-person classroom, while also working to address the fact that some students will be taking the class from here in Ithaca and others might be in China.
Boston University wants me to take the risk, or the gamble really, that my students will be as rigorous about adhering to safe practices around coronavirus as I have been for the last 120 days. As much as I love my students, I'm unpersuaded that that is going to happen. But if there's one thing that this pandemic has demonstrated to us, it's that we are all vulnerable. We're all vulnerable because human health is not siloed. Human health is interdependent. My exposure can become your sickness.
The message to us on campus is that we better be very clever about our room scheduling, about our testing, and about our messaging to students and faculty about doing the right thing.
Like all my colleagues, I miss being in the classroom terribly, and I can't wait for the day when things return to normal and we can be there in person for our students again. But for now, health and safety have to come first, and I'm very lucky to be at an institution that respects those needs.
I love the experience of being able to discuss matters face-to-face with all of my students. But that's not what we're talking about at this time. We're talking about teaching with masks on, with everyone wearing masks, with people being socially distanced throughout the class, while trying to also teach online at the very same time.
Now, in-person teaching may be preferable under normal circumstances, but this is just irrelevant during a once-in-a-century pandemic when we have safe and effective virtual alternatives at our disposal. Neither pedagogy nor financial considerations are going to justify this carnage on campus and the suffering that's going to be inflicted on surrounding communities, including and especially communities of color. The true test of moral character is how well one performs not under ordinary times, but in times of crisis, and many colleges, sadly, are failing this test. If they don't face the reality of this pandemic and they continue down the path of magical thinking, they will have blood on their hands.
Allison, good afternoon. Another tough day in Florida. 9,200 cases reported. Certainly, we've seen much higher numbers in recent days, 15,000 in one day over the weekend. But it's the fatalities that's grabbing headlines today. 132 deaths reported in this latest batch, and that now brings the state's total to 4,400 fatalities. It is the fourth time in 6 days, Allison, that this state has seen a new peak in increases. So concerning when we talk about the cycle of infection to hospitalization, and the concern there was that there would be an increase in deaths. That is what we're seeing on some level right now as hospitalization numbers are rising, hospital healthcare systems, I should say, getting stressed, and testing, a major part of the conversation. Where I'm standing right now at the Miami Beach Convention Center, there are lines of cars down the block right now. Some of those folks have been waiting an hour, 2 hours, 3 hours in some cases. They are going until 5 o'clock. There's not a shortage of tests. There's a shortage of manpower. And at the end of that, 5 o'clock, if there's still people waiting, which there have been in recent days, they don't get tests. There is also the lag time problem as well. Right now, Florida is supposed to be hitting 48 hours between when you get tested and when you find out. But there's folks that are going 5, 6, 7 days. We've talked to someone who waited 15 days, Allison, to get that test back. Imagine waiting 2 weeks to find out whether or not you have COVID-19. And perhaps even more shockingly, one of the top infectious disease experts for the area, Dr. Eileen Marty, said that at this moment, Florida right now is only doing 17% of the tests that it should be doing in order to contain the virus. So huge testing numbers, but clearly not enough yet Governor Ron DeSantis talking right now about trying to expedite ways to get people faster results, creating lanes that are just for symptomatic people. Perhaps that will work. But the state right now waiting for a little bit more guidance as cases and deaths, sadly, continue to spiral.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.